Welcome, Self-Care CEO listeners. You all, I have Carol Yeh-Garner. I am so excited for you all to hear what she has to say. It is so pivotal in this time and space that we're in that our discussion today is going to be so good. So, do you want to say hello to everyone?
Hi, everyone. Thanks for joining us. I'm excited to be here.
Yay! Okay, so before you all got here, we had some fun with the internet. So just know that we're gonna try this out, and if not, we're gonna do a part two, and we're gonna just knock it right out of the park. But for now, we're gonna keep things rolling and going. So let me introduce you all to my new friend, Carol. So she is someone who actually helps people save money on their holistic health care. This is wild. And the other thing that she does is she is a certified hypnobirthing childbirth educator. And she has done this for over 600 clients. So let me just say that she's someone you want to hear about that. Also, she is a hypnotherapist specializing in infertility. If anybody has been watching the news, you know that there's this special thing that's going on, and it's so expensive to have infertility issues. So I am so excited to dive in. What's the first thing on the top of your head that you're like, I've just got to get this out right now?
I think the health plan, especially with everything that's going on in the world and the government, we need better health care. We need better health coverage. And we need to actually inform people that there is a health insurance alternative. So most people, get work, they get their benefits through work. And if you don't work or you work for yourself, you're just kind of left up in the air, looking on the different websites, trying to figure out what plan should we have. And my family of four, we're very holistically minded. We rarely go to the doctor. We were paying $2,300 a month for a PPO through Blue Cross Blue Shield. Yeah, this is a couple years ago. We each had a $7,000 deductible. So that would have been crazy. But we wanted a PPO because we thought if anything happens, I want to be able to see whoever I want to see, which really isn't that true. But at least we wanted not to be locked into an HMO network of doctors, right? We rarely went to the doctor. My daughter, who was 19 at the time, she got strep throat. We tried all the natural things. Eventually, we just said, we need to go to the doctor. We need to get her an antibiotic. And called the pediatrician that she had been seeing. We don't do the wellness checks or anything like that. Um, Plus, she's 19. She's healthy. And I called them and they said, oh, she hasn't been here in 3 years. Sorry, we can't see you. And I was like, excuse me? You're the pediatrician and we would still be paying the doctor visit. We need a 10-minute appointment with the nurse practitioner or a PA, physician's assistant. I know she has strep. You're going to look at her throat. It's a 10-minute appointment. I'm going to pay you $150. And they said no. And we had to go to urgent care, wait in urgent care for a stupid antibiotic. Yeah. So once that happened, I was like, this is ridiculous that we're paying this much money and we can't even get into her pediatrician's office. So had heard about health shares a while ago and I just got overwhelmed. And this was the straw that broke the camel's back. And I started looking into health shares. So a health share is a health insurance alternative in 5 states.
Is this just for your state only, or is this across the board?
This is across the US. So I'm in California.
Listen to what she's about to say. Okay, I'm so sorry to interrupt, but I had to find out.
There's 5 states that don't recognize health shares as Affordable Care Act compliant. We just pay the fine, whatever. We're now paying $940 a month. For our family of four, we have a $5,000 called an annual max because we can't use insurance terms with a $1,000 family max. So like if all four of us got in a car accident, we wouldn't have to pay $7,000 each like our PPO was going to require. We would pay $10,000 for the whole family. This also includes the holistic health plan that is so innovative. There's nothing else like it. So we get $0 telemedicine. We get $0 virtual mental health services, 13 30-minute sessions with a therapist on video call. And then you get your medical and emergency and catastrophe covered. You have an annual max, which is like a deductible. The deductible or annual max prices are $1,000, $2,500, or $5,000. Obviously, the higher the annual max is, the lower your price is. And then it's divided up by age bracket and how many members are on your plan. The cool thing about this health share though is you could have 12 kids and it's still the same price. Some health shares and health insurance plans have a cap of, 4 or 5 kids, and then for every kid beyond that you have to pay a fee. This one doesn't have
Wow.
that. Yeah, so if you have a large family, this is a great alternative. So the money that we're saving on our monthly premium, we're fine with paying the tax penalty in California for not having insurance, which is just a full-on scam. Like
So you
everyone
have to
has.
pay a penalty for not having health insurance in California,
Yes.
but you get to still have this
This
plan.
works like insurance. We just can't call it insurance because it's a health share, and California, New Jersey, Delaware, Rhode Island, Washington, D.C., and Washington State are the other states. If you're not in any of those states, it's not even a problem. So, yes, you get your medical and emergency catastrophe covered, included, right? There's a little bit more work involved in a health share versus a health insurance plan. So there might be more paperwork that you have to submit, more follow up on your part. However, the
Okay.
cost savings makes it worthwhile, right? Then let's talk about the holistic plan, because this is where it gets really, really cool that I think your listeners are going to love. So, anybody who loves to go see the acupuncturist or chiropractor or naturopath, that costs a lot of money, right? And a lot of people want to go and see those kinds of practitioners, but it's out of their budget. This plan allows you to go see a naturopath up to 5 times a year, and you're going to get $150 back for each of those visits within
Is
30
that a
days.
naturopathic doctor or a naturopathic
Doctor.
doctor?
Yeah. Naturopathic doctor, a doctor of osteopathy, or an MD. So you still get the $0 telemedicine with the holistic plans. There's 2 holistic plans. There's one called the savings and one that's just the regular. So even if someone's getting their traditional health insurance through work, then keep
Mhm.
that. But maybe if the family is on that plan through work, you might want to look at the health share side of things, get the family on the health share plan
Oh.
through this plan. And if you like all the holistic stuff, then get everybody on the holistic plan that can be added on. The holistic plan can be added on to any health insurance, whether you have traditional health insurance, marketplace insurance, whatever. But it gives you
Would
that
that be
zero.
their supplemental?
It's kind of like a supplemental. Yeah. It's not technically a supplemental plan. So even people on Medicare can sign up for the holistic plans. Yeah. So you get the $0 telemedicine. With the holistic savings plan, you get 3 of those doctor visits, including naturopathic doctors. The cool thing with that is, if you want to go see get a skin cancer check, you can go see anybody. There's no network. You want to go see your naturopath. There's no network. Yeah. The whole plan, even the health share, has no network. So, like, if you wanted to go to the Mayo Clinic for, whatever, you could go out of state and see whoever. You would have to get that like pre approved, but you could go see whoever. So, the holistic plan, the holistic savings plan gives you 3 of those doctor visits. The regular holistic plan gives you 5 of those doctor visits. Then you
Okay.
get 12 chiropractic or acupuncture visits, or tour chiropractor or acupuncture visits per person per year. So calendar year. So if someone enrolled now, they would get 24 or 12 visits in December. And the cool thing with
Get it
those,
done.
yeah. The cool thing with those is find yourself a chiropractor or acupuncturist that has a wellness center. And if you go and get a chiropractic adjustment and go get a massage or facial or whatever other additional service they have, and you get it on the same day, it's itemized on that same invoice, you will end up getting $175 back in cash, direct deposit in your bank account within 30 days.
I'm
Then
liking this.
I know it's amazing. I helped kind of develop this plan, and it was like everything that I could wish for, I get. So you get the 12
Really?
with savings plan, you get the 24 of those with the regular plan. And then with both of those plans, you get $50 worth of essential oils or supplements reimbursed every single month with the specific
Wow.
company that this plan is through. And then with the holistic plan, you also get one IV drip per month where you're going to get up to $100 back. And then you also get one thermography or mammogram per year where you end up paying the first 100. Anything over that is reimbursed. So
And you
thermography
get
is
to
a
pick
great.
your own place for that?
Yes. Yeah. And so thermography is a great alternative to mammograms. There's no radiation involved. It's a great, you're technically, ideally supposed to get a thermography once every 6 months, and it's a heat scan, and it really pinpoints where there's inflammation in different parts of your body, which can show up more issues than a mammogram.
At
So
what
all,
age is that? Is there an age? Because you know how insurance has at this age you need this. Is that
yeah,
also in that?
there's no age requirement for that. If
I'm
you
just
want to go
assuming you
get,
have to be at least 18 or the provider's
yeah.
discretion.
Yeah. 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 So the company that we partnered with to create this health plan, the CEO is very holistically minded. The medical director is very holistically minded, and they see the value of people being proactive with their health because they know
Mhm.
that the people that go see the acupuncturist, the chiropractor, the naturopath, that do IV drips, that get all those additional kinds of things, that use oils and take supplements, they're generally very healthy, right? They rarely go to the doctor, so they're
Right,
not costing the plan a ton of money. They're rarely, if they are on any medication, they're not on a ton, right? They're not the
right.
kind of people that like want a pill for every little symptom and then get another pill for the side effects. And, next thing you know, you're on like 15 different medications. And they know that all these people that do these kind of proactive, holistic services tend to have less chronic disease long term, less illness. So long term, there's less cost for the plan, right? So they're willing to invest in us and reimburse us for being proactive. Like this is one plan you actually want to use, the holistic or the holistic savings plan. You want to max out
I
all of
absolutely
your
do.
right? Yeah.
I
So
would make every one of my appointments.
I know. Like before this plan came along as a mom of two, everybody else's care was the most important, right? I always was like, yeah, I should go see the chiropractor, but like I got, time, money, whatever. Now I'm like, yeah, game on. Let's do this. I've got 24 of these sessions. I'm doing that. I'm getting my massage with my chiropractic visit. I'm getting a holistic facial with my chiropractic visit. I get all these amazing services added on. There's a copay or a visit fee. So you pay the practitioner. The practitioner is getting their money. So there's no risk to the practitioner. They're actually increasing their revenue
Do you
because
all
they're,
hear that?
yeah,
Providers, you don't have to wait for the middleman. You don't have
exactly.
to wait for that. What?
Right. Yeah, they're going to actually increase their revenue because if they have other services, then it makes way more sense for these clients, patients to add on the extra services without the practitioner feeling bad about like, oh, the cost of it. Like, I don't want to recommend because I know they're on a tight budget. So the
Mhm.
patient or member pays the practitioner upfront. The practitioner just needs to give them an itemized receipt that they submit to the health plan, and then within 30 days, they're going to get the direct deposit of that reimbursement. So each of those services, acupuncture, chiropractic, naturopath, IV drip, thermography, those kinds of things, there's a visit fee involved that gets deducted from the total that the health plan keeps. So with the chiropractic, they're keeping 35 of whatever the total is that you paid. With the doctor visits, they're keeping 20. With the IV drip, they're keeping 25. So it's a very minimal visit fee. And then you get the
Yeah.
rest $175 for the acupuncture chiropractic, $150 for the doctor visits, $100 reimbursed. Anything over that is the patient's responsibility. But still,
Okay.
if I were to pay for a 20-minute chiropractic visit plus a 90, 60-minute massage, like I'd be paying a lot of money. But I worked it out with those practitioners. They've all signed up to be promoters of this health plan because they can earn some commission. They now know when I come in, our visit fee is going to add up to $210. That's the $35 fee and then the $175 reimbursement because I want to maximize my reimbursement and get as much money back.
Right.
Yeah. So this plan, there's nothing out there like it. It's really amazing. With this plan also, there's no pre-existing condition exclusions. So if you do have
Really?
a chronic disease, autoimmune, cancer, whatever, and you prefer to do holistic treatments, it gets really expensive.
It
This
does.
is going to save you so much money and allow you to get additional services and see your practitioners more often because it's not going to cost you a ton out of pocket.
So if they wanted to do any kind of, let's say the facility that they were at, and that facility had, you mentioned some essential oils. Are there any supplements? Like, let's say they needed to be put on cohosh or dim or probiotic five, like they have like dysbiosis. Are there any
So,
supplements that are there?
yeah, so the company that is the company that I work with that partnered with the health share company, that company has supplements and they have oils. And so it has to be from that company, that specific
Sure.
company. They don't have DIM, they don't have some of those things, but they have a lot
Okay.
of different supplements that meets a lot of people's needs. So anything from that specific company, $50 for an individual per month, $75 for a couple or single parent with kids or family per month. So our family, we're getting $900 back a year of money for the products that we would have been purchasing anyway because we love all these products. It's really there's nothing out there like it.
Okay. Wow. So, is there a, cuz everything sounded great. Is there a menu? Is there a list of treatments? Because to me, I mean, if I was listening to this, I would be like, okay, she said a lot of stuff, a lot of services. Maybe some people are visual, maybe some people are
Yeah.
auditory, but to me, I want to see it with my eyeballs. Now, go through that with us.
Yeah. So I have a website that has a chart of all the different main services the
Sure.
acupuncture, the chiropractic, the naturopathy, the IV drips, thermography, the oils and supplements reimbursement. There's also benefits consultants through the health share company that people can book free 30-minute calls. So if you are on traditional health insurance and you're paying out of your own pocket, maybe
Hmm.
you're on Medicare, maybe you're on marketplace insurance, book a call with these benefit reps because this healthcare vendor, they do all of it. They do the health share, but they also do all those other traditional health insurance plans, and they might be able to save you money and get you a better plan that meets your needs. And then you could add on the holistic plan with the money that you're saving. So
Oh my goodness.
the main website has tons of info, website has tons of info. Then you've also got a benefits rep that can look at like, here's the plan that you're on, here's what we can offer you. And if the plan you're on is better, they're going to let you know. They're not going to try and persuade you just to get on their plan. If the plan that you have is good and it meets your needs and it's the best cost, they're going to tell you just stay on that plan.
So I'm assuming, yes, because we will. This podcast will have links. So what would you say step one would be for the listener that is listening to this? Because maybe they've heard 20% of what we're saying, right? Because we remember 20% of what we're receiving.
Right.
So in that moment, what would be their first step to do?
I would say find out what you're paying now for your health coverage, who you're paying it to, because a lot of people are like, I don't know, I get it through
Okay.
work or whatever. Find out
Yeah.
what your plan costs every month, what's covered, what's not, what your deductible is, and then check out the website, it has all the charts, it has all the, all the things that are covered. And the second step would be check out the website. The third step would be set up a benefits consultant meeting to talk to somebody if you have questions. The website's pretty thorough though.
So if they live in Ohio and they want to do this, they would go through all those steps that you just said. Whenever they get to that fifth step and they talk to you said a consultant,
Yeah, benefits.
is all of this free up to this point?
Yeah. hmm Yes. And you can book as many of those 30-minute benefits consultant meetings as you need to. It might not be with the same person, but they'll be keeping notes and they'll be able to look at your records. The one thing to know about the plans is there's month to month enrollment. So open enrollment's coming for a lot of people, but this is
Mhm.
month to month. So it's year round. You want to know, if you're going to switch, you want to know what the cancellation policy is for your current plan. But if someone signed up in this month, they would not have services, but then starting the first of next month, they would have services start. So they could set up
That
those
sounds
appointments.
traditional. Yeah.
Yeah. They could set up the appointments for November, the first of whatever month that their services are going to start, and start getting those holistic services going. If, we're in November, so if they signed up this month, they could have 12 or 24 of those sessions in December. And
So
then
if you're watching this in March,
right.
just know that it would start in April, right?
Yeah, exactly.
More people don't know this. And this is the first start. As soon as I heard you talking about this, I knew that this had to get out there, because to me, I can't keep my big mouth shut, because if I know of something great for other people, I can't help but share it, right? Carol,
Same.
we are now best friends, and I think we've just made like a ton of new friends now. But part of me is just so upset of how much. Remember what you were talking about in the very beginning? You were talking about the thousands that
Mhm.
people would be out of money. Now,
Yeah.
I do have a question. So let's say that family X
Mhm.
has the family member like broke a bone. Now, is there something in there that would be a self pay if they needed to go somewhere and receive treatment? This is just for
This
continuing healthy care.
Yeah. So if you're generally healthy, these plans are for you. The health share part of it. The holistic plan, you can have a pre existing condition. So, with the health share side of things, if someone broke a leg, they would go to the hospital, they would show their member card. That member card would tell the hospital to bill the health share. And then the health share would bill you for whatever your annual max is, the 1,000, 2,500, or 5,000. Anything over that, the health share would pay for. So a health share is a nonprofit health organization. It's a community of
Oh,
people that pool their money together, and we're pooling our money together to help pay for everybody else's care. It's
yes.
nonprofit, which is unlike most health insurance companies where they're trying to keep as much money as they want to pay all the higher ups, right? Is different because it's a nonprofit, and that pool of money, I mean, they've paid millions, multi-millions of dollars out for medical procedures and stuff like that. It doesn't cover wellness stuff, so that's going to be out of your own pocket. So if you have a family and you want to go do those pediatrician well checks every year, that's going to be out of your pocket. I don't think that those go towards your annual max. Annual max amount, the deductible amount, is only for like medical emergency catastrophes, like illness kind of things. But I think most people don't know um, that this even exists. And then it's a really hard thing to kind of wrap your mind around because we've been so
Yeah.
ingrained to believe that health insurance is important to have. Everyone has to have it by law now, right? But most people are so ingrained in thinking like insurance is my safety net, right? And it's regulated by the government. But I don't know about you, but I've seen so many different stories of people that did have insurance and, they had to file for bankruptcy because they didn't know that once that deductible is met, you still owe 20% usually. The insurance company will pay 80. But if you have a huge life changing event, you still are going to owe a lot of money.
And
There's
they
an
can still deny. They can
exactly,
still
right?
deny, and then you would be
Right.
at 100%.
Exactly. Yeah. There's an astounding stat that 65% of bankruptcies are due to medical debt. And 90% of those people that had to file for bankruptcy because of medical debt had insurance, which is,
Is that not wild?
yeah. And, you know, I've seen people who went to go get MRI, they didn't tell them they had insurance. They said, okay, the MRI is going to be like $900. And then the MRI
Mhm.
facility found out, like, oh, they have insurance. It's going to be, you know, several thousand. And now this person has to pay their deductible, which is several thousand. And they're like, well, wait, it was going to be like 900 paying cash. But no, since you have insurance, now you're responsible for your deductible, which is thousands of dollars. So it's really a very corrupt system that I think the more of us that get out of it, the better things will be, right? Because the less of us that are feeding into that broken corrupt system, the better.
So what about functional medicine, like nurse practitioners that are functional medicine? Let's say they own like a med spa, and inside they want to do a weight loss program, and inside their program they want to do IVs or ozone or red light therapy. Could they do something like that?
They would be able to get, if they have the holistic plan, they'd be able to get that IV partially reimbursed. They'd get $100 of that IV. Right now, functional medicine practitioners, nurses, they aren't covered. But the cool thing about this plan is it's only been around for, it'll be 2 years in February of next year. So it hasn't, the holistic part of the plan, the company has been around since like 2018. But the holistic plan, this specific one, has only been around for less than 2 years. And they're constantly kind of figuring out like what can we upgrade to and make the plan better. So the way that it is now is fantastic. It's only going to get better.
Yeah, there's so many women that are looking for hormone health there, but the doctor doesn't listen and they want to put them on a prescription. And the next thing you know, they're stuck on this prescription forever and you don't know when to get off. And it's that weird cycle.
Yeah.
So I'm excited to do a follow up. Don't you all think that we should do a follow up that whenever they do speak to some of the other practitioners and see if there is something that can be integrated or if there can be a phase two. It'd be really great because I know so many naturopathy practitioners, especially nurses, functional medicine, board certified. These are board certified
Right.
functional medicine providers that
Hmm.
want to do this. And I also know I know doctors that are leaving their practice to become functional medicine so they can get outside
Yeah.
of of having to put on so much to the patient. So
Right.
I hope that the next time that you and I talk about this, I hope there's a phase 2. I hope there's a
I
little
do.
bit of a phase 2.
Yeah. Yeah, I agree. And even those practitioners where their services might not be covered by the holistic plan, I think just they should still promote this plan to their patients because their patients are probably wanting to do all of those other kinds of things. And if they can save them some money on those things, then that just feeds into allowing them to come and see the functional medicine people, practitioners more because it's not going to cost so much overall.
It's a thought of someone either paying their house, their mortgage, and then paying the health insurance. The health insurance is all day long going to take their money,
Yes.
and then you've got a mortgage to have to pay for. But then you've
Right.
got, it's so interesting. So it's like you almost can't afford to get sick, but you have to afford your mortgage and your health insurance, and both of
Right.
them are going to get their money. And then
Yep.
you lose. But
You
what's so
lose.
neat about what I hear about this is that the client wins. They get their health insurance, which is mandatory. So they are serving. But what's interesting to me is I have never in my life heard of I think did you say mental health? Did you
Mhm.
say a mental health?
A $0 mental health services. Yeah.
This world needs this. There are so many different, you said something about there's no specific age range. So
Mhm.
imagine that the person in your home that is needing to see a counselor or to see those specific
Yeah.
providers. Now that provider has to take that
Well,
type
for the
of
plan. So the with the
plan.
virtual
Thank you.
with the virtual mental health services, it's through a company that the health plan company brokers with. So they do the telemedicine and the therapy. So you don't even have to find somebody. You will get the same
That's
therapist over and over and over. But yeah, if you have your family on this plan, each member gets 13 30-minute sessions per year, per calendar year for free.
Oh my gosh, I know people who don't even go but like maybe like twice a year for their tune up or for their
Mhm.
their maintenance. Mental health is so important. I know you know this, but for me, I really think sometimes people not sometimes. I know that people just need someone to talk to and you don't feel comfortable at talking to your counselor at school or or to try to find a counselor and then it's going to be 2 months because they're
Right.
booked and then
Mhm.
you're going to have to talk about things that you already talked about, but this
Yeah.
is someone that already knows you. This is, if anything, this is like so exciting because
Yeah.
mental health, you're not just chewing on prescriptions, you
Mhm.
actually have someone to talk to and get it out. Oh, this is so
Yeah.
fantastic.
Yeah.
Carol,
So the
why does
$0
everybody not know this?
$0 telemedicine. So that's 24/7, 365 days a year. Wherever you are, if you feel like you have something coming on, you're going to get a nurse practitioner or a doctor on the phone, video call or regular call within 10 to 20 minutes of you getting on the app. That's great. And then they do
Mhm.
everything. They can do concussion protocol. They can look at a cut and determine, like, does this need urgent care? Does it need stitches? If not, here's what we recommend. They follow up with you the next day to make sure that everything is okay. They can write prescriptions. So my husband does have one prescription for asthma. He just has an inhaler just in case. We use oils for most everything, but he does have that prescription and he used to have to go see the doc, like make the appointment, take time off work, go to the appointment, wait for a 10-minute thing of like anything new. Nope. Okay, here's your prescription, right? And pay
Right.
150 something dollars for that. He literally did it on the phone. Once the doctor or the nurse got on the video call, I timed it. It was 2 minutes. He was done. He got his prescription refill. They called it into the pharmacy. He was able to pick it up 15 minutes later. Time
Okay,
saver.
so there's two different kinds. You've got the mental health and then you also have the
Zero
what's the
dollar
other one called?
telemedicine.
Can you talk a little bit about prescriptions? Okay, because that is interesting. There
Mhm.
are chronic things that we understand. You understand that naturopath is just going to kind of need to take, it's just going to need to open the door, a gap a little bit to allow prescriptions because an asthma attack is,
Right.
you know, you
Medication
need
is
those
there.
specific
Yeah,
things.
they're great as needed, right? But it shouldn't be
Yeah.
something that's just like handed out like candy at every doctor visit. So obviously, like there's medication that people are living life better or that are saving lives. So I don't know exactly what the formulary is, but they do have a prescription formulary that they work with. And I believe that some of the generic medications end up being $0. If not, they worked things out so that they're very, very discounted. I know my husband's asthma inhaler is like $20 less than what he was paying with our insurance.
Really?
Yeah.
Oh my goodness.
Yeah.
Do they also get someone to explain? Because obviously they get to go to the pharmacy and someone gets to explain their
Yeah.
instructions for their medication.
Yeah. The pharmacist. Yeah.
Now, just I know because people are going to ask, is there anything with healthy living, anything with preventative medicine? Is there anything with weight loss with this yet? Do you see anything coming down the pipe or that's available yet?
Yeah. So with the health share plan, the medical emergency plan, if someone is morbidly obese and their doc, like this is a new thing, one, they're on the plan. It's not a pre existing thing. If they're
Okay.
new on the plan and it's a new diagnosis of needing weight loss support, whether that's
Mhm.
surgery or meds, that would obviously have to be pre-approved. I don't know of anybody that's gone through that part of it. I do get a lot of feedback from different members and stuff like that. But I do know that weight loss is part of what can be covered if it's approved.
That is
Yeah.
so fantastic. Okay, well, so now I know we have a few more minutes, but I wanted to take a little bitty baby dive into talking about what you do. Now, I'm curious if what you do, if it's part of this program, because you talked about the hypnobirthing and different things like that. Is any of this included in that program? Or okay, so is there anything else you wanted to mention about the health plan that we did not discuss? Because I would love to take like 5 to 10 minutes to talk about the other thing that you do.
Yeah. I think the only other thing would be I did research like what it would be costing our family if we had stayed on that PPO, and it would be $3,200 now
$3,200 a month.
if we had stayed on that Blue Shield PPO because it
And
kept.
that's just insurance to that's just money to the insurance company. That
Mhm.
doesn't even mean that you saw anybody. And
Right.
that still doesn't even mean that you're gonna get a yes.
Exactly.
That is instant cash. I want that. You pay
I
me,
know.
I will pay your bills. If you
Right.
do that math, that's 30 something
Mhm.
thousand dollars a year. You could have taken your family to France,
I
first
know.
class.
I know. Yeah. It
Are they
makes me.
taking their families to France first class?
I mean, they're doing a lot. Yeah, it makes me
Oh,
sick to think we paid for a PPO for over 20 years because we thought that's what we should be doing. We thought we were being smart by doing a PPO, but it is what it is, lesson learned. So I just want people to know that there is an alternative out there, even if you live in one of those 5 states that does not recognize a health share as Affordable Care Act compliant. You're probably going to save money. And if you're not saving money, you're getting better services with all those free, the free $0 telemedicine, the $0 virtual mental health, all of those kinds of things. Definitely, definitely worth looking into because everything is going to continue going up. Insurance prices, I mean, on the news, it's potentially going to skyrocket. And so we need to really pay attention to where we're putting our money and make sure that what we're investing in actually is going to work for us, not a plan that is going to deny us, deny us, deny us for all the things and end up with having medical debt. So, yeah.
I don't want to say it, but the insurance company's favorite word, I have learned it. I have learned it for it to be no.
Yeah.
And when you go to prescriptions and then when you go and you think you've got a good deal on prescriptions and then they raise the price,
Mhm.
the pharmacies do, and then it's just like, I I could cry.
Yeah.
Love this. And it's nonprofit. Y'all, you don't even understand. There are some nonprofits out there that are, ugh, okay. But like, could you imagine a nonprofit share plan that actually gives you money and you get a massage and you get chiropractic care? We had a chiropractor on the show and she was talking about all the wonderful mental health benefits that even came with that kind of chiropractic care. Oh my gosh, y'all. This has to be the way of the future, y'all. I really think that this has to be forward thinking. Share this podcast out with everybody that you know. And then if some of it made sense, if even 20% of it clicked, look into the description part of this podcast, this message, and call. And you know what? Healthcare just never takes a day off. It's 365 days a year, sometimes 366, sometimes 364, but it's always 24/7. And you never get sick on a Tuesday at 2:25.
And have
You know
an
what I mean?
appointment open. Yeah.
And there's just magically that. And then y'all, I'm Carol. I love you so much. Oh my gosh, you're my best friend now. Isn't she our best friend? Oh my gosh.
Yeah.
Okay. So I want to take a little bit if we can.
Okay.
And I want to dive in. So this last 10 minutes or so, I want to dive in. Okay. So how did you get involved into hypnobirthing?
Yeah, I got pregnant with our son and I was planning hospital birth. I was planning epidural, all the things, because that's all I knew. However, I was really scared of getting an epidural. I was scared of getting a needle in my back. I didn't want to be, subject to having an emergency C section. I did not have any positive birth stories in my life, but I knew there
Mm.
had to be a different way. And so I was watching A Baby Story, which was a show on TLC, half-hour little show that followed like pregnant couples. I watched it every single day. I tape recorded it on the VCR, like I'm that old. And I found an episode where this mom was birthing. She was in the hospital. She's laying on her side. Her eyes are closed. She looked like she was asleep. She had Pitocin and she was using hypnobirthing. And after, when they interviewed her after the birth, they asked her, like, so what did you think of birth? And she said it was enjoyable. And I was like, what? How? What? And so I immediately was like, I don't know what this hypno whatever is, but I'm signing up for it because if I can have like a smidgen of enjoyable for this birth, like I'm willing to do whatever. So signed up for the class, dragged my husband, like just went in super skeptical and learned that I was very easily hypnotizable. I'm a type A person. Hypnosis is all just self hypnosis. No one's like in control of you. It's just using your mind.
That's good to know. Did y'all hear that? No one's in control.
No one's in control of you. It sometimes looks that way on TV, but that's not real. All hypnosis is
So they
self.
don't snap and then you all of a sudden just have your baby. I want that.
I mean, it basically almost was like that for baby number 2. But what you
Oh,
learn, you actually dehypnotize yourself in the class that birth is this painful, traumatic, awful, medicalized experience. And you rehypnotize or reprogram your brain to understand that your body and your baby are meant to do this naturally, normally, and comfortably, just the way that God, the universe, whatever you believe in, designed us to do. And so it's all about the fight or flight response, which also ties into infertility. When we're scared, we tense up. When we tense up, our body immediately goes into fight or flight, which sends more blood and oxygen to our brain, our heart, and our lungs, and our arms and our legs so that we can run and get away. Our uterus is a set of muscles that's sending blood and oxygen to those muscles and to the baby. If more blood and oxygen's going to our heart and our lungs and our head, not enough is going to those uterine muscles, which is basically what a Charlie horse feels like, right? When you have a Charlie
oh,
horse, not enough blood and oxygen is getting to that area. That's why we have pain in birth, is because we're tensing up, we're not breathing, and we're telling our body this is not safe. So our body is actually working against
no.
us, not for us. So hypnobirthing teaches relaxation, deep relaxation techniques so that you can stay calm and focused instead of freaking out and tensing up and holding your breath and tightening up everything. You're breathing, you're staying calm, you're focused, you're feeling things. Like it's not like you're not feeling anything, but you're feeling things. And even if they are extremely uncomfortable, you're still staying calm. And that allows all the blood and oxygen to go to the uterine muscles and to the baby so that you're not having an emergency C section because now the baby's in distress, right? Everything is working the way it needs to. You learn a different way of pushing. You learn that gravity works with you. So you're going to not be on your back, ideally. And you just learn all these
Whose
different techniques.
idea was that?
I know. It's the doctor's idea because they get to sit there and see everything, right? It's the only good position for the doctor. It's not a good position for you. But the dads, the partners that take my classes learn so much. They get to be completely involved in this birth. They know how to support mom in labor. It's a beautiful, beautiful thing. Even if people do end up having to get interventions, they know that they did what they needed to do and that the interventions were actually truly medically necessary versus you need to fit in the box that the hospital wants you to fit in of 1 centimeter
Right.
dilated per hour. And if you're not, get the Pitocin, then you get the epidural, then more Pitocin, then more. I mean, there's a whole thing.
Oh,
Everyone pregnant should watch a movie called The Business of Being Born. It's documentary. I think it's free on YouTube. It is mind blowing how much money hospitals make from the birth process and C-sections. So hypnobirthing, I ended up having 2 really wonderful hypnobirths. My first was 7 hours, 40 minutes of pushing. He came out with a nuchal hand, which means that I had to get all of this out of me and I didn't tear. It was
no,
uncomfortable.
no tears?
No
Oh my gosh.
tears.
Okay.
Yeah.
Wow.
And then my second birth was 2 hours, pushed 3 gentle nudges. She came out completely pain-free. Both babies were 8 pounds, something ounces, so fairly decent sized babies.
Okay.
Yeah. And so I have my master's degree in social work. My goal with my degree was open up a private practice in therapy. And by the time it came time to do that, I was like, I have no brain cells to do that. I have 2 kids under the age of 3. And so a friend of mine said, why don't you teach hypnobirthing? You had 2 great experiences. So I did that for 7 years, taught over 600 couples. I just got recertified now that my kids are 19 and 22 and I have more time. I'm teaching classes online now, and it's a 5-week series, 2.5 hours each, and you learn everything you need to know to have birth, whether it's a hospital, birth center, home birth, partners get
Wow.
involved, and you learn to get rid of your fears. You do fear release hypnosis sessions and just help you realize like this is something your body is naturally capable of doing. The US has one of the highest maternal and fetal mortality death rates. We should be number 1 in terms of our healthiest moms, healthiest babies. We have all the technology in the world. I haven't checked the stats lately. I think it's like 43. We're 43rd in the world in terms of maternal and infant mortality. So just
Oh.
because the hospitals have all the things does not mean that that is the best environment. So we have to be proactive going into birth, knowing the questions to ask, the things to do to ensure that we stay, as long as mom and baby are doing okay, right? That we stay in
Mhm.
control of the birth room and the process and make sure that it's all working for mom and not against mom. The same thing for hypnofertility, hypnosis for fertility. That fight or flight gets in the way of being fertile. The body knows if you're stressed, and infertility is so stressful every month, month after month. And so it's a 12-week series of sessions that I do with my clients, and I do a little bit of education of mindset, nutrition, different things
Mm.
along the way. But there's always a hypnosis session that is involved in it, just helping moms and their partners get their bodies to realize like we we can be fertile. You just need one egg. You just need one sperm. They just need to meet. And that environment needs to be hospitable. It needs to be welcoming. But if we're freaked out, stressed out, which is kind of constant with fertility stuff, then the body's going to be like, well, what do you want? You're stressed out. It's not a safe environment. It's not welcoming because you're stressed. But you say you want the baby, right? And you hear those stories of people saying, fine, I'm going to just stop trying. We're going to adopt or, whatever. Then they get pregnant naturally, right?
Right.
Because that stress, that constant stress is gone. So that's what I do in addition to helping people with this health plan.
I think that's so fantastic. So now I know that you're going to provide us information for the first thing that we talked about.
Yeah.
Is there a separate bit of information that we can have that if they wanted to book an appointment with you or to check and see if that's something that is for them, is that some information that you can provide for us that's separate? Because obviously you just said those are two completely different
Yeah,
things.
yeah, it's all on my website. All 3 of the things that we discussed are on my website, which I know that you're gonna have in the description. So people
Uh-huh.
can go learn about the health plan, learn more about hypnobirthing, learn more about my hypnosis for fertility sessions on my website.
Ugh, okay. Well, if you all are not crying by now just gripping your steering wheel to hurry up and get to where you're going so that you can check out this website and click on the description information, this is why I will tell you, I have never found a podcast that had this type of an interaction. I get it. We can all talk and go back and forth, but this is real material that practitioners need they just need a springboard. I'm saying your business is doing fantastic and you don't need this podcast to get that information out there because I mean it's already doing fantastic, but this is a great way that all the way over on the east side of North America, because I'm assuming this is just US only, like North America only.
Mhm. The health plan is,
Obviously,
yeah.
okay. Yes. And I'm sure your hypnobirthing would be super helpful across seas because that's phenomenal anywhere. So this is why self-care CEO, this is why we're here, so that practitioners who do phenomenal things get their information out there, and so that services that are available that no one's going to tell you. Nonprofits really rarely do a commercial because, for one, those are tens and hundreds thousands of dollars. But I guarantee you, if they could have been on a big football game, the one where they throw the ball and it's in February, if they could be on that commercial, I guarantee you, you would have to hire more people
Right.
because this right here. I hope that this information gets out so far and so wide. I hope you all share this. I hope you give this podcast 5-star review. I hope that you go to these businesses. Nonprofits still love a good review because, I mean, nonprofits still, they really thrive off of reviews. And if it's not for you, and if it's for someone else, if someone is crunching granola, send it to them because you will eventually see how well they're doing and how much money they're saving. And you will go, hang on a minute. You are saving so much money. I want to go first class to France too. All right. So give us some last minute, like if there was anything that we talked about today and you're like, this is so important. What's a last minute share that you really want us to know?
I'd
We
say
talked about a lot.
we did talk about a lot. I think the last thing I would like to say is just think outside the box. There are solutions out there for the majority of the things that we're all dealing with. And I appreciate a podcast like this and the opportunity to talk about the things that I do because we need more people to understand there are options out there. We just tend to get stuck in a rut and think this is the only way that because that's all we've learned, right? With health insurance, with
Right.
birth, with fertility, like we only know what the media has shared with us and what we've been programmed with over the generation, decades of our lives. And there are alternatives available that can help you. So that's my message.
Oh my gosh, I am so excited. Self care is another form of wellness, and I really hope that you all find that your self care can be actually taken care of, and it does not have to, lead you into bankruptcy, as Carol mentioned with those statistics. That's wild, you all. We've got to get out there. We've got to share this message. Carol, we've had some wild rides with this internet, but we are
We did it.
trudging through. This information is getting out there. They will hear it and know it. And I just want to say thank you. And don't you all, Carol, don't you think you want to come back? Don't
I
we
would
have
love
more to
to.
talk about? Don't we have phase 2 to discuss?
I would love to. Yes.
Okay, well, you all stick around. Make sure you subscribe. And make sure you go to Carol's website. If she has anything, subscribe to that. You will make sure that you're the first one to turn on your notifications so that you don't have to wait for a commercial to pop up for you to hear any information. Thank you all so much. Thank you, Carol.
Thank you.